Hello, my name is Kathleen Lisson. I'm a lymphedema therapist from the United States, and I wanted to share with you my notes that I wrote when I attended the recent lymphedema seminars. Lymphedema seminars is an excellent online full day class. It's administered by Shush Kratzer. I will put the website so you can enroll in an upcoming lymphedema seminar. And it's a really great way to spend a day learning from experts in our field of lymphedema. So today we talked, or this was last week, but last week we talked all about lipedema for this edition of the lymphedema seminars. So I am going to cover the notes I took for two of my favorite Karens, Dr. Karen Herbst and also Karen Ashforth, both talking about lipedema. So the first one was Dr. Herbst was up and she talked about a new characterization of lipedema. She was seeing as she was trying to describe and look at cases of people with lipedema, she saw the need for there to actually be half stages in between the whole stages of lipedema. So go ahead and look online for that new those new images. If you're used to just seeing one, two, three, etc. stages, like there's half stages now, and kind of look in and see if that fits for you, these more specific definitions of exactly what's going on in each stage. The first other things that she talked about was conditions that she feels make lipedema worse. So this is important for us because we're not just treating the leg, we're treating the whole client. The client does not just have lipedema, they have the whole of their body, and all the medical conditions can interact with one another. So some conditions that can interact and make lipedema worse, according to Dr. Herbst: arthritis, autoimmune conditions with inflammation, depression, trauma, adverse childhood experiences, hypermobility, insulin resistance, fatty liver, metabolic disorder, mast cell activation disease, a slow lymph flow or lymphedema, and vein disease. Any one or multiple of these can affect the lipedema, making the lipedema worse for the client. She talked about lifestyle-based treatment of eating and exercise, reducing inflammations with supplements and medication. Compression is important. MLD is important. We talked about different types of deep tissue techniques, manual therapies. We talked about GLP-1 agonists, surgery, and pneumatic compression devices. She also explained about the role of glycosaminoglycans. So glycosaminoglycans are upregulated due to that increase in interstitial fluid. So the hyaluronic acid is going to bind to fluid to increase the interstitial pressure. It's the body's way of trying to balance the fluid flow. And I feel like I can feel the hyaluronic acid, those glycosaminoglycans, under my fingers when I am doing the therapy for people. Then we turn to we turn to Karen Ashforth, who's an OT, and she talked about some things which are important for people with lipedema to do for their self-care. The importance of lowering inflammation, of lowering body mass, of decongesting regularly. Increasing the quality of life is important. Decreasing pain is important. Increasing mobility and function is important for these clients. And she talked about some treatments. She talked about ultrasound cavitation, Shockwave, IASTM, instrument-assisted soft tissue mobilization, and antifibrotic compression as things that we can have in our toolbox when we're helping our clients with lipedema. So I highly, highly recommend these conferences. It's one day. It happens a couple times of a year. I believe it's usually the Saturday, maybe the Sunday, but usually the Saturday. And it's a really excellent way, especially if you can't get out to the conference and spend $1,000 on the flight and the hotel, to get in person with your fellow lymphedema therapists. Lymphedema Seminars is an excellent way to get online and really be able to hear in-depth presentations on the topic of the day, and then have ample time for questioning. So they will do the presentation, stop for questions, presentation, stop for questions. They'll do a couple of speakers like that. Then they will have like 20-minute modules where we're having a roundtable discussion on a certain topic, and you are absolutely encouraged to ask questions, to share your experience. So it's not just us getting the value of the speakers that are coming, but in between for these roundtable discussions on the webinar, we're hearing the experience of our fellow therapists that are coming. And it's usually like 50, 60, 40, 50, 60 therapists there from all over the United States and even outside of the United States. So it's an amazing opportunity. There's one more in 2025. And if you miss that and it's 2026, go to the website and see when the next lymphedema seminar is, see if the topic inspires you and excites you, and then sign up for this excellent class. Thanks and have a great day.